So the topic I'm going to speak to tonight is baby brains and social policy. And when I mean talk about baby brains, I mean actual babies. Sometimes they say that women have a baby brain when they're, in the early years after the birth, but I mean actual babies. So I don't know if anyone's heard about, in the last 2 decades, there's actually been a lot of research on baby brains. So that they've realised that actually the early years after the birth, there's lots happening in the baby brain. And I'll talk a little bit about that later. But there's neuronal connections happening, often that's how it's talked about, and the brain architecture. And when I hear this talk, I often think, what do they mean? Neural connections and brain architecture. Isn't there a baby there somewhere? And it makes me, the image that comes to mind to me is a brain going onto a pillow, and somehow or other you feed it manure and it sort of blossoms. But babies aren't like that. And fortunately there's other people who are seeing that way, and I'll refer to that a bit later. So all this talk about baby brains has led to an early education industry. It's a whole new department in universities. And childcare workers, I'm not against it. I think it's fair enough to have early childhood education. Fair enough, I guess, to have toys, all those toys that teach kids to, stimulate their brains and things. And there's childcare. But I want to bring in the notion of it takes a village to raise a child. And I think through our social policy framework, we can create a 21st century village if we decide we want to. So I'll go a little bit through history. And in the early 20th century, there was a breadwinner model of the family. So it was the male breadwinner and the female carer. And then we had the 1970s with the women's movement. So we moved towards equal pay, haven't quite got there yet. Aged care, childcare, home health, which I think is fantastic. Look at our parents often get someone coming in, helping them with a shower. There's lots of things that have come out of the 1970s that we all benefit from. And also we've got all these women now who are doctors and lawyers and politicians and judges and astronauts and artists and writers.
Prime Ministers?
And Prime Minister even. Not for long, but... But now we've got the independent worker model of the family, which generally means when there's children in the home under 7 or 8, that it's a 1 full-time worker and a half-time worker. Usually women work part-time to accommodate the care. The latest thing that I heard in terms of statistics on that was, there are more men who are being the primary caregiver, but the statistics on that is like 3 to 5%, so it's not exactly a big trend. So it's this continuing commodification of care. We haven't really figured out how we're going to do care now, because we've got male workers, female workers, and really it's the women are trying to do 2 jobs generally. So now, in terms of baby brains, you might have heard there's an international movement now called the First 1,000 Days. And in this movement, they talk about the critical first 18 months of a baby's life. And something I like about Rostrum is I have to do a little bit of research, and I always learn something. So one of the things I learnt with this is that we all have billions of neuronal pathways in our brains. It's done amazing. And with babies, 1 to 18 months, or birth to 18 months, amazing. It's hard to imagine, but there's 1 million connections happening every second, not every minute, every second. So the first 18 months, they say that there's so much happening in a baby's brain that it's the basis for lifelong. And in terms of not just cognitive development, but also their health, our health, heart disease, all kinds of other health issues. It's that first 18 months to 2 years provides the foundations for a healthy life. And even our Conservative government acknowledges the first 1,000 days, and they talk now too about the first 2,000 days. And there's committees set up, there's talk about programs, there are attempts to try and respond to that first 1,000 days, which generally, and this is my gripe, turns into childcare subsidies, early childhood development, and also training parents how to be good parents. And I don't know if anyone saw the ad that was on television about 6 months ago, and there was like this little toy that was like an alien, and the parents were changing the baby's nappy, and the idea was that when you talk to the baby, the little alien thing lights up. So it's time to tell parents to talk to their babies, which I think is a bit weird myself. There's so many other things parents could do with. I mean, maybe some parents need to learn to talk to their babies, but there's so many other things that they need. So in terms of social policy, in Australia we have universal 18 weeks paid parental leave, and that means that generally the woman gets 42% of the wage. That's about 4.5 months. And then if you've got a career or a good job, well, you can supplement that with negotiate with your employer and get that other further pay. But I don't know of anyone that gets paid more than a year, even in those sort of circumstances. So I looked up again, back to the research. So I looked up the OECD chart, and this was August 2019. And again, a lesson for me. I was amazed to see, and I don't know if anyone knew this, but Estonia is the best place in the world to have a baby. They get 3 years. The primary carer gets 3 years paid leave. That's 166 weeks at 50% of the wage. That's followed by Hungary and Finland that get 160 weeks at 40% and then 25%. So it depends on the country what percentage you get. But at the cost of going on a bit, I'll refer to Norway gets 91 weeks, 47%. Austria, Sweden, Denmark and Japan. We all knew about the Scandinavians, but I didn't know about Japan. They get something like 60 weeks at about 50% of the wage. I thought you might be interested in Canada, a kind of comparative country, gets 51 weeks, and France 42, and the UK 39. We get 18. So Dr. Tim Moore, someone I admire in this field, and he's done a lot of research and published in this area. He works at Murdoch Children's Research Institute in Melbourne. And he says something we probably all know, but someone has to say it. The brain is not purely cognitive, it's also profoundly emotional. So it's not just neural pathways, there's a child there, and it's kind of insulting, I think, to talk about babies in terms of brains. So he says we need holistic and integrated services that respond to the social determinants of health, supportive communities from pregnancy, and respond to the physical and the emotional development. And the message from Dr. Moore is education, empowerment, and respond to the environment. So the 21st century social policies, I say, should include adequate paid parental leave, but also, why don't we try and create a 21st century villages? That's for mothers, fathers, families, uncles, grandparents, neighbours, and support young families.